So, Dr. Christine Dierickx, can you tell us a little bit more about your background?
Yes, Tim. I am an aesthetic dermatologist who specialized in laser surgery. And my career has been quite international. So I was trained as a dermatologist in Belgium. Then I moved to the Netherlands to do a subspecialization in phlebology. And after that great experience, I moved to the States, where I started in California to do a fellowship in laser surgery. Then I went to Madison, Wisconsin at the university, where I did a Mohs surgery fellowship. And I eventually ended up in Boston in Harvard Medical School with Dr. Rox Anderson, the father of laser surgery. And here I was for 7 years involved in research, developing different kinds of lasers. And this is where I found that aesthetic dermatology is today really scientifically based. We, at the time, about 20 years ago in the meantime, we developed the lasers for hair removal. It took us 5 years before we were successful, but it was done in a very scientific way. So aesthetic dermatology today, I like when it is science-based. So after laser hair removal, fractional resurfacing came along, cryolipolysis, pico lasers, all indications are that we are using lasers for with very good scientific background.
And HydraFacial has a lot of personalization tools to really get into this different kind of types. Can you maybe expand a little bit more about these skin conditions all throughout the year?
I certainly can, but I want to pick in remember the first patient that we treated together in summertime. She had a very severe acne and had very greasy skin. Since that treatment, she became a regular customer.
Wow.
She is so pleased with what the HydraFacial could do for her skin after having tried out so many other treatment modalities. So, in more particular, if a patient comes to me with acne, HydraFacial becomes part of my standard treatment regime. So like I said before, I always take a picture, show to, usually they are young adolescent patients or a lot of young female patients. We see more and more female adult acne. I explain to them the nature of acne, what causes it. We look at the different symptoms that acne can give on the pictures together, and also at the equilibrium of their microbiome. Often you see an overgrowth of a specific microorganism called C. acnes. So once they have a good understanding, I always stress on very good home care. It's important that they clean their skin twice daily and then apply medical prescription drugs. They're either against the inflammation that we sometimes see, but mainly they are based on derivatives of vitamin A because it has a comedolytic effect. It will loosen up the comedos that are in your skin. And so 6 weeks later, they have to come back, and then I perform my first HydraFacial treatment. Because with the pre-treatment, the comedos are easier to be extracted with the HydraFacial treatment, and that works in our advantage. The other remark I get from the young adult acne patients is that they found that the peeling isn't cumbersome or painful or discomfort. It doesn't give them any discomfort at all. They like the fact that the extraction by suction, it's much more pleasant than the extraction by pressure. And often by pressure you get a lot of red marks afterwards. With suction they don't. And for that young population, it's very important when they walk out my door that their skin has no side effects. So I found that a very advantageous feature of the HydraFacial as a treatment modality. It's the patient's first of all, the experience. It's always a pleasant experience, and the lack of side effects afterwards. For me, it is another treatment modality that increases my efficacy, because the better I can remove the comedos, which is the initial lesion, the more we can prevent the inflammation afterwards.
How do you look at the hyperpigmentation issues and sensitive skin?
Another pigment indication I see a lot are women with melasma, which is a very long-term therapy-resistant hyperpigmentation in the face. And this is for them cosmetically very, very disturbing, because they have to camouflage it every single day. And those women really would love to come out without any makeup on. Even skin is very important to them. Like I said, it's also a very therapy-resistant skin condition. And the patients that come to me often have tried many other modalities. And since I am known as a laser expert, they come into my office and expect that the laser will solve their problem in 1, 2, 3, which is not the case. So again, we look at the pictures, I educate them, we look to see where the pigmentation is it superficial or is it deep, and then we will define the treatment modality. At first, the first choice is certainly not laser. First, they have to protect themselves very good from the sun. We start with topical antioxidants, and in the evening with bleaching agents. After 6 weeks, we do the first checkup. If this program works, we keep them on topical treatment. If it doesn't work, then the second step will be the use of lasers. For that, I use a very particular laser that will not aggravate the melasma, because it's a very sensitive skin disorder. If you're too aggressive with your treatment, it will get worse. So I know which treatment parameters, which laser to use depending on the skin types, but I always combine it with the HydraFacial just before and after the laser treatment. So what I do before are the first 2 steps, which is the exfoliation and then the peel. The peels are very soft and will not trigger irritation in their skin. After I did those 2 first steps, the skin surface is very even. So when I do then my laser treatment, there will be less reflection and scattering from the light. The light will penetrate deeper and more efficiently inside the skin, where it will do its specific treatment on the melanocytes. So immediately after the treatment, I perform then the last step of the HydraFacial treatment, which is the infusion, where I use the butanol with the pigment lightening agents, and of course afterwards we apply a sunscreen. And I find the combo treatment more effective than the laser treatment alone, because I pre-treat the skin for optimized laser treatment, and immediately after I apply a lightening agent on the areas of concern.
And how about rosacea skin, sensitive skin, and skin that's really sensitive to a lot of treatments that we cannot do today? How do you treat them with the HydraFacial and lasers, for instance?
That is the main reason why people here in this neck of the woods come to see me. Rosacea and sensitive skin is a main concern to a lot of patients. So again, my strategy, very simple, we take pictures. When you have sensitive skin, Patients report that they cannot tolerate a lot of products, that everything stinks. And if you look at the polarized pictures, you see a chronic inflammation inside of the dermis, which is an objective indication of that sensitive skin. One step further is then the typical rosacea, where the vessels start to dilate and you see the individual vessels on the nose, the cheeks and the chin. And it can go even further, where patients develop some kind of an inflammatory acne with papules and papulopustules. So what is common in those patients with sensitive skin, rosacea or acneiform rosacea, is that their skin barrier is impaired. They don't have a strong external skin barrier. So the first approach is then again to educate them, to tell them which are the right products to clean your more sensitive skin. What can we do to repair that skin barrier, to reduce the sensitivity? That is again home care. 6 weeks later, we are going to implement personalized skin treatment, which I always do with the HydraFacial. I found it remarkable how that sensitive skin tolerates the exfoliation, the peeling very well with HydraFacial, because we can use the adapted products like the Rosacea, adapted for that skin type. So we are dealing with first making the skin stronger with the right skincare products. Secondly, reduce the chronic inflammation with the HydraFacial treatment. And then if there are broken vessels, also part of the symptoms, then we will use the laser to treat the broken vessels.